So hello everyone, my name is Jeff Daniel, and I'm a pediatric nurse for the 4th Street Clinic, which is a homeless clinic downtown Salt Lake City, and we provide free comprehensive health care to homeless individuals regardless of their ability to pay. So that's what I do, and I work predominantly with the children and moms, parents, dads too, all around Salt Lake City.
Alright, so wanted to focus on homeless children. So how do homeless children access health care?
So I thought about this question. I really think that it's more of a question of insurance and hierarchy of needs. Oftentimes homeless families don't have insurance because they are more worried about shelter, food, that type of deal. So when they want to access health care, oftentimes they're in a crisis situation and they need to either just go to the emergency room and see providers that way. But what happens is they incur a lot of costs on themselves and also in the community because people can't afford. So oftentimes hospitals will absorb the cost and it makes it more expensive for other people. So offset society costs a little bit. And so our goal is to have people go more to a primary care place, a primary care physician where they can get their treatment instead of emergency room visits, which cost a lot on everyone's pockets. So they access it usually in their crisis modes through the emergency rooms, but if they had insurance, different story.
Okay. Let me see here. So other than 4th Street here, is there any other clinic specifically serving the homeless population?
We're the only clinic that serves the homeless population here in Salt Lake City, although there's other clinics that have a sliding scale depending on insurance, where people will pay a smaller copay if they don't have as much. And then we also have, throughout Salt Lake in different clinics, providers that will volunteer their hours pro bono basis, but that's usually worked through the 4th Street Clinic. So we've built relationships with providers and doctors in the area that will provide free service for our clients.
Okay. And so do you believe homeless children are negatively affected by the current healthcare system?
I think the answer to that is definitely yes. It's a big question of access to healthcare and insurance, and oftentimes our statistics demographic-wise here at the 4th Street Clinic, about 80% of our patients are uninsured. So we absorb the cost of that through our own fundraising and stuff like that we do. But yeah, I think definitely it negatively affects their health. Oftentimes people don't just have a little problem, they have an extensive problem and they need to see specialists. So that's a string of events that has to happen, referral after referral after referral, and oftentimes that just doesn't get met with people that are just worrying about shelter and food.
Right.
Yeah.
So those individuals who do come in with insurance, how do they get insurance? How did they get that? Why do they have it?
Good question. So the 4th Street Clinic is a 501c3 nonprofit organization. So we get main funding through grant writing, in-kind donations, volunteer doctors, and services like that. But if the person doesn't have insurance, we also have caseworkers here that will get them started in the paperwork so that they can get into Medicaid and continue to see us if they want to at this clinic. But it also gives them the option to shop around, quote unquote, to go see if they like other doctors if it's closer. People don't have transportation.
Right.
So we're conveniently located a couple blocks away from the shelter, so it's an easy location for people that don't have any option.
Right.
And then we try to empower them in a way by getting them insurance. They can continue to see us, once a patient, always a patient, but they could also go and look for other doctors closer to home or more preferred.
Okay, so they do kind of have a choice of
They do have
doctors.
a choice. When they first come here, they don't, because this is what we have. But we work really hard to give people options. So, and I think we've seen a lot of people come back to us just because they enjoy it here. And we try to provide good care.
Yeah, well,
like any other doctor's office.
Yeah, definitely. Yeah. So working with the children, what do they usually come in with? What are a lot of the diagnoses?
Diagnoses. kids come in for a variety of reasons, just like anyone does. You could fall and break your leg one day, or you could just have a cough.
Okay.
You could have a diaper rash when you're a little baby,
Okay.
or you could have scabies or lice or anything like that. And so they come into us, we see them for any type of whatever reason it is, and we then make referrals, specialty referrals if they need it into the community with some of our partner doctors that do services for free. And so, and we also have in-house volunteer doctors that will, ear, nose, and throat, dermatology, stuff like that, that'll take care of the problem here in the clinic.
Okay.
So yeah.
Sounds good. Is there anything else you'd like to say about the homeless children?
Homeless children, their needs are great. They're at high risk for a lot of things. Developing attachments, mistrust, abuse. There's a lot of things that kids go through, not in just developing as a human being, but also in their current state of crisis. It's just so much more. So, yeah, but I think being mindful that people are in this situation is really, really helpful. And I think also to just be educated. You can find out more information at the 4thstreetclinic.org or any of our the roadhomefamilyshelter.com or anything like that. Just, yeah.
Just be informed.
Just be informed and know that people struggle, and be aware of that. Be culturally competent.
Right.
Yeah.
And out of people who come to the clinic, what's the percentage of adults and children?
So last year we've seen. Last year I think we saw 6,000 pediatric patients. This year we've already probably even doubled that.
Wow.
So so we do see adults and children, but it's easier to access the care through the children's side because there's not as high a number of children as there is older adults that are still out on the streets and stuff like that. But there is a huge number of families that fall into homelessness every year. About 15,000 in Utah alone.
Wow. Wow.
A year. So
wow.
Shows you how much we're really catching, how much we're really serving.
Right.
But at least there's something.
Yeah.
So to start.
Definitely.
Yeah.
All right.
Cool.